So I want to start off by kind of evening the playing field about those core foundational principles of affirmative mental health care. Now, I'm going to assume that some of these terms look familiar to a lot of you, but I want you to hang in there with me. Don't completely tune me out just yet, because I want to talk about how these very specifically influence your clinical decision making. Trans people, your trans patients, have the right to determine who they are. And they have the right to expect that you will believe them. So trans people have the right to determine who they are. And they have the right to expect that you will believe them. Now, in order to do that, we have to be willing to challenge that social construct that tells us gender can only exist within the binary, male, female. Now, while some of your patients will identify within that binary, for example, transgender male, transgender female, however, many will not. And we also need to be willing to expand our understanding and our acceptance of non-traditional relationships, and also our acceptance and our understanding that people have a right to decide how they want to express themselves sexually within those relationships or outside of those relationships. Now, when your patients come to see you, they come to the table, they come to that encounter with multiple social and cultural identities. For marginalized, historically marginalized populations, those multiple identities, they intersect and they collide. And those create health inequities and they create social injustices. Our responsibility is to be aware of those social injustices, be aware of those health inequities, work with our patients to navigate that. We need to work to mitigate the impact. And we also need to work directly with the trans community as their allies to eliminate social injustice and health inequalities.